So very good evening and warm welcome to Zivya IVF. मैं सबको today I like to tell you a little bit about Zivya IVF and Dr. Naina Patel, and then hand over the webinar to Dr. Naina Patel to then share with you the myths and facts about IVF. So here you go. I will share my screen so that I can tell you a bit about Zivya IVF. So Zivya IVF, as the name suggests, as the name is very new. Can you all see it, please? Can you all see? Pratmesh, can everybody see it?
Yeah, we can see.
Thanks. So as the name suggests, the name doesn't suggest, Zivya IVF एक बहुत ही unique नाम है. This is inspired from Greek mythology. The meaning is Lord of Fertility and Life, and this name is given by Dr. Naina Patel. And we say life begins here because this place is really for people who are struggling to start a family, and therefore we are here to, help people help couples have a child, and so their life can begin. So this is a bit about us. I think what is important to note, जो बहुत important चीज है कि मैम की Dr. Naina Patel is the brainchild behind Zivya IVF. And her team and herself have an experience of 30 years plus. She is one of the leading IVF specialists and surrogacy expert in the world. She has delivered 18,000 plus healthy babies and has delivered 1,600 plus surrogate babies. Her protocols are time tested and have worked, and people all over the world come to Anand, Gujarat to get treated from her. Our vision for Zivya IVF is that we are here to serve people and to bring joy and happiness among patients by giving them the gift of life, which is a child. And our mission is to be one of the most trusted IVF clinic chains in India and fulfill the dream of parenthood. We want to be known for our protocols, for the ethical and transparent practices. We are here to serve people and not to fool them. Why us? We are very ethical and transparent. We will be very transparent with people. We have the best equipments. Our facility, which you will see in the presentation now, is state of art. We have highly experienced fertility experts. We have Dr. Richa Ananya Aluwalia, who's leading the Jaipur clinic, along with Dr. Renu Sharma. We have EMI, facility, which makes treatment very affordable. So हमारे पास EMI facility है, जिसे आप installment में pay कर सकते हैं. And most importantly, यहाँ पर we give personalized and holistic care. It's not just about you coming here and we treat you as a patient. We will actually hold your hand till you get the child. We have all kind of treatments available in Jaipur, and so there is IVF, IUI, XC. We also have infertility treatment for men. So basically everything to do with male infertility, TISA, PISA, all those treatments are available. And also Dr. Naina Patel is known for her research in this field. And she now has tried ovarian rejuvenation, then DNA fragmentation, all the acupuncture in infertility. And all these things have really helped increases the chances of pregnancy. We have the top-notch team, and we are very, very proud to be a part of the team. Dr. Naina Patel, and she is the one who inspired the team, or to me also, to start this chain, Zivya IVF. Just a little bit about her before we hand over the webinar to her. She is MD Ops and Gynac with 5 gold medals. She is the only doctor who's appeared on Oprah Winfrey Show and on BBC. She has more than 30 years of experience. I've already said that she's delivered so many babies, 18,000 and 1,600 plus surrogate babies. And look at her awards. I think the awards, we could not fit it on a slide, so we've only put what could come here. So every year she's awarded as the Luminaries of Doctors Award, Women Leadership Award. She's been awarded by the former Chief Minister of Gujarat, the best IVF center. I mean, you name everything, and then, it's right in front of you, which you can read. And it's really a pleasure and an honor to have Dr. Naina Patel here with us for this webinar and have a talk about myths and facts of IVF. बहुत लोगों को बहुत कंफ्यूजन होती है कि आईवीएफ अच्छी चीज नहीं है या फिर है, कराना चाहिए नहीं कराना चाहिए, कैसे कराना चाहिए, इससे हम लोगों को बहुत प्रॉब्लम होगी नहीं होगी. सो मैम इज हियर टू बस्ट ऑल द मिथ्स एंड फैक्ट्स. And also just so that आप सबको मालूम है, this webinar will be taken live on Facebook. So as we are speaking, you can have your friends and family members also join on Facebook to see this webinar live. Over to you, ma'am, for the webinar.
Good afternoon, everybody. Thank you, Shweta, Renu, Prathamesh, and the Zivia team for this webinar, which is so very important. Myths and facts in IVF. IVF treatment के बारे में तो सबको पता है, पर there are so many confusions, and people who undergo IVF give their own experience, share their own experience, but हर एक couple is different. Nobody is going to have the same problem what the previous couple had, or the success rate also एक couple से दूसरे couple में different होता है. We know that 1 year if you try to conceive or pregnancy नहीं रुकती है, so that means you have infertility and it is increasing now. Various reasons: lifestyle, stress, delayed pregnancy, environmental toxins, pollution, everything. So किसी को 1 साल तक बच्चा नहीं हुआ, या तो किसी ने बोला आपको infertility है, that doesn't mean that you will never have a child naturally. That means that you need little bit of treatment, proper guidance, and you can conceive naturally or with IUI, or may need a laparoscopy surgery or IVF, but you can conceive. One very important myth is that IVF तो female में जब problem होती है तभी करना पड़ता है. Like we need to do IVF because the female has a problem, and the infertility is also because of the female. It is not correct. Only 30% of infertility is because of females. The remaining 30% is male, and then combined, and some where we do not find any reason. So nowadays ICSI जो करते हैं हम, that is mainly for the male factor. Sperm count बहुत कम है, motility नहीं है, the sperm count is very very low, motility is not there, the sperms are very morphologically abnormal, then that female may be totally normal. She has a normal uterus, normal ovaries, normal tubes, but because the husband's sperm is not able to fertilize the egg naturally, we have to do the ICSI and IVF to get an embryo and put it back. So it is not that because of the female we are doing IVF, it is because of the male also we are doing IVF. Another myth is that young couple को benefit होता है, mature ladies cannot get pregnant with IVF. True. IVF, the earlier that you do, at a younger age you do, it gives better results than after the age of 35 of the female. Why? Because men है, वो लोग हर 2 महीने में नए sperms produce करते हैं. Low number होता है, कम होता है, पर फिर भी new cell बनता है. Whereas in a female, by birth, ovaries में eggs है, you are born with a certain number of eggs. So as you age 35, 36, 37, all the toxins in your body will act on the cell. Like your skin is not the same what it was at 25. Your hair is not the same what it was at 25. So at 37, 38, even your egg cell is affected and becomes weak, becomes abnormal. So earlier you do IVF, it is better. I have seen couples जो आते हैं, नहीं IVF तो last में करेंगे, कुछ नहीं होगा तो IVF करेंगे. But भैया आपके sperms तो देखो 5 million है, 6 million है. आप 10 साल भी try करो, you will not conceive naturally or with IUI. Why don't you do earlier? Your wife is still 25, 28 years of age, 27. Her eggs are so strong. Those eggs will compensate for your subfertility. Eggs अच्छे हैं, sperms खराब है, तो भी result अच्छा आ जाएगा. पर अगर eggs भी बिगड़ गए, तो result will be very low. So if you are a genuine case, like tube remove कर दी है, ectopic हुआ है, both the tubes are not very good, the location of ovary is not good, or the sperms are really bad, go for that IVF at an earlier age than a later age. Common myth that I had one pregnancy, I conceived very naturally, easily when I was 33. So why should I have a problem? Now I'm 37. Hello, you have a problem. आपको problem है. क्योंकि एक बार pregnancy रही, delivery हो गई, that doesn't give you a guarantee that you can't have infertility or a secondary infertility. Secondary infertility is possible if your age is more than 35, husband had some problem, diabetes हुआ, कुछ surgery हुई, and the sperm count is going bad. So that means there is a problem and you need some help, maybe IUI, maybe laparoscopy, maybe ICSI. So once you had a baby and then after 7 years you think I'll try and I'll get naturally conceived in 2 months, may not be possible. You may need IVF or IUI. People feel that IVF is only for rich and famous. पैसे वाले लोग ही IVF करा सकते हैं. आम जनता के लिए IVF नहीं है. That is wrong. Everybody needs IVF. It's an expensive treatment, but not that expensive that a common person cannot do it. I will calculate the cost and I'll explain to you that why. IVF has now become affordable. There are EMIs available. Cost of IVF depends on the injections we use. If we use urinary injection, gonadotropins, कब हो जाता है? हम recombinant और बहुत अच्छे injection use करें तो महंगा हो जाता है. Also, the disposables. We have indigenous disposables, या तो बाहर से imported आते हैं, तो that would be expensive. We can adjust the cost by adjusting all this. So there are packages which depends on the cost of the injections, cost of the disposables and the procedures we do. Even if you take a lower package, it's not going to compromise your IVF cycle and it's not going to give you a bad result, but yes, slightly lower than the expensive one that you take. So it is not that it's going to cost you a huge amount of money and that it's not affordable. Only if you are rich, you can do it. Aisa nahi hai. Weight has no effect on fertility. Weight does have an effect. If you are overweight, husband and wife both, if you are obese, motapana hai, so you have to reduce your weight to get a better quality of egg, better quality of sperm and implantation rate. Too thin a female, zero figure jo aa gaya hai, that is also bad. So you should put on weight so that the chances of implantations are high and miscarriage is low. People think that, oh, I've tried everything, 9 IUIs, laparoscopy, nothing has worked. IVF is 100%. I'll get a result. No, IVF is not 100%. 35-40% एक cycle में आ जाता है if you are of the average age and everything is on the borderline. 3 cycle में I would say 70 to 80% would definitely conceive, and in some cases even 90%. But if you the older the age of the female, the chances of conceiving goes down. So that is the reason I say the earlier you do IVF, the better is the success rate. It's never 100%, but cumulative. That is, 2-3 cycle को इकट्ठा करके, it can come to 80-90%. That's why the clinics offer 3 cycle packages, which will be beneficial to you, because the same clinic like us, we will analyze why it did not work for the first time, how differently we can approach you second time, what is the best technique we use second time, and give you a better success rate. So I would always recommend my patients to go for a package of 3 cycles. Because if you are lucky, you get conceived in 40% first time, maybe that cycle will be little expensive, but you have that pregnancy. If you are unlucky and you do not get conceived in 2, that third cycle would be like literally free cycle for you. So package of 3 cycle is the best. 40 years के बाद बहुत ग्रेट कम हो जाता है, जैसे 20-25%. Another thing, people feel that whatever infertility problem I have, IVF can deal with it. Majority of the problem, yes, but there are certain issues like bad adenomyosis, uterus खराब है तो सरोगेसी की जरूरत पड़ती है, या एम्ब्रियोज बनते ही नहीं, अरेस्ट हो जाते हैं तो एग स्पर्म अच्छे नहीं, डोनर भी लेना पड़ता है. तो with all this third party, yes, you will definitely get a result. But there are some issues like बहुत बड़े fibroids, you need a laparoscopy before you do IVF. You may need a hysteroscopy before you do IVF. So all these treatment put together, definitely I would say that 90-95% of the couples can now solve their infertility problem. There are couples who come to me and then they say, we went to this clinic and we did it, we burnt our fingers, now we have come to you. And I asked them why. हमारे घर के पास ही था, it was very near, walking distance from my house. तो मैंने सोचा वहां चली जाती. That's not correct. You don't look at the distance. You don't look at the accessibility like 2 minutes में चली जाऊंगी, या इसका थोड़ा rate कम आता है तो मैं इधर चली जाती. No. Find out the good doctor, a good clinic, and the techniques and the latest advances that they have, the personal touch that they are giving, how they are helping you to solve your problem if it doesn't work. So all IVF clinics are not the same. You have to very wisely select your IVF clinic, which is transparent, which is result oriented. And that is very important. Number game is not important. It is the result game which is very important. So excellent facilities, personal touch, transparency, and latest technology. कोई बोलता है कि IVF सेफ नहीं है, उससे शरीर खराब हो जाता है. No, it is a very safe procedure. Even the hyperstimulation is now almost 0%. So it is safe, your body is not getting harmed in any way by doing IVF. And that it can be done only once in a lifetime. No. I have done the highest number of IVF cycle which a patient had was 14 when she came to me. And in the 15th cycle with a donor egg, we gave her a baby which is now almost 8-9 years old. So even my real brother had 7 failed IVF in the US. Then I did his cycle with donor egg here, and twins are 22 years old. So IVF, you can do any number of time, but with each cycle, there should be an improvement that what different and how different we can do. IVF में hospital में दाखिल होना पड़ता है. No, you don't need hospital admission. It is a daycare procedure. For egg retrieval also half-day procedure. For embryo transfer also half-day procedure. It results always in multiple pregnancy. No, if we transfer one embryo, then only chance of one pregnancy, one blastocyst में. And that the babies जो IVF से born होते हैं, उसमें malformation आता है. वो baby अच्छा नहीं होता है, खराब, उसको बाद में problem आ जाएगी. That baby will not be able to have a baby then. These are all myths. ये गलत फहमी है, गलत बात है. The malformation या कोई खराबी होना बच्चे में is the same almost as a natural conception. Only thing, because the couple has infertility, उसके egg and sperm या उसके own genetic में कुछ problem है, that's why they are not conceiving. Yes, they can transfer it, but it is not a procedure which is going to give malformation of the baby or going to give a baby which is not going to be healthy. First IVF baby जो Louis Brown है, 43 years, she has conceived naturally और उसके खुद के children हो गए हैं, उसको तो IVF की जरूरत भी नहीं पड़ी. So IVF children are the same as a naturally conceived child. There are many couples who feel नहीं, we don't want to do IVF, नहीं करवाना है, किसी का अंडा ले लोगे, किसी का sperm, हमें कैसे पता चला हमारा है? No, it is always your egg and your sperm. If we have to use a donor egg or donor sperm, we have to take your consent and then prepare the egg donor or select the sperm. So it's never, and for that you can always have a DNA test once the baby is born. So it is always your egg and or your sperm which is used for the formation of the embryo और गर्भ बना के आपके अंदर रखना है. IVF is a painful procedure, they say. I would say it is a very simple procedure, almost painless. What happens in IVF is that you have to take 10 days of injections. Normally, आपका एक अंडा बनता है. Normally, you had one egg, but for IVF, you need a cohort of 10, 12 eggs. So for that, from first day of period, we give you injection. और वो इंजेक्शन ऑयली नहीं है, आपके हिप पे नहीं लगेंगे, जस्ट beneath the skin. अपने forearm की skin के नीचे, it's just given beneath the skin. If a patient of diabetes and a young juvenile diabetes can take lifelong insulin just beneath the skin, दिन में 2 बार 3 बार, ये तो एक इंजेक्शन एक बार लगेगा दिन में, और for 10 days. Can't we do that to have a baby? अपना खुद का बच्चा करने के लिए तो that is the minimum sacrifice that we can get. So these 10 days of injections. The second point is we go for egg retrieval. Egg retrieval is always under anesthesia. You just get an injection in your vein. आप सो जाते हो, नीचे से अंडे निकाल देते हैं. There is no cut, no stitches. You can walk up after 3 hours, go home, evening do your routine activity. So, if बहुत सारे eggs बन गए, like there are too many eggs, your ovaries can give you some discomfort, जैसे थोड़ा थोड़ा दर्द रहता है. So that is for a day or 24 hours, and we tell you that don't do any high impact exercise, ज़्यादा वजन वाला काम मत करो, and within 2-3 days also it can come down. So after that comes the embryo transfer procedure. So embryo transfer, so while you are awake only you do it, and you put the embryo inside the uterus, and while you are awake you can see in the sonography that your embryo is going inside, the bubble goes along with it, the embryo. Rest for 2 hours, go back, और बाद में complete bed rest. I cannot even sit for a moment, doctor, how can I take bed rest? Nobody is telling you to take complete bed rest. पूरा आराम करने की जरूरत नहीं है. Don't do any high impact exercise या weight bearing exercise, ज़्यादा वजन वाला काम, dancing, और बहुत पूरा traveling पूरा time, वो मत करो. But there are patients who fly from here to Dubai, America, and get a result positive. Normal routine work, you can do it. They say you just have to sleep straight, side में भी नहीं घूम सकते हो. That is wrong. You can move to your side, you can sit, you can walk, you can cook your food. Everything is allowed. Painful क्या है IVF में? The mental stress. For 2 weeks after transfer, you will be continuously worried. मेरा result आएगा, नहीं आएगा, आएगा, नहीं आएगा, positive होगा, negative होगा. 10 दिन में तो मैं test करने लगती हूँ, positive है, negative है. That stress is the mental pain that you have. So I tell all my patients that don't take that mental stress. You have done your best, rest is in God's hand. All you can do is take your medicines on time. Painful injections भी नहीं लगते हैं. अगर आपको ऑयली इंजेक्शन से डर है तो प्रोजेस्टेरोन के एक्वेस पानी वाले इंजेक्शन आते हैं, या तो जस्ट वजाइनल टैबलेट्स, वजाइनल सपोजिटरीज एंड जेल्स कैन सफाइस विद ओरल टैबलेट्स. And you do your routine, get into your routine activity, and don't think of the result. Like what has been said in Bhagavad Gita. Your job is to do your work. Don't look at the result. So that is what I always say, that meditate, think positive, and those 2 weeks will pass by and you will get that positive result. So IVF is not a painful procedure. IVF pregnancies is only a cesarean delivery. That is also wrong. Once you pass 3 months, it's like any other pregnancy, and you can also opt for a normal vaginal delivery. But these couples have waited so long, or after IVF, they themselves are scared, and at the drop of the hat, they would want to go for a cesarean rather than a normal delivery. They want to do an elective cesarean. बस हमारा cesarean कर डालो, हमको बहुत डर लगता है, बच्चे को कुछ हुआ, हमको नहीं ऐसा चाहिए. So that is the reason. Otherwise, IVF patients can have a natural vaginal delivery. And this is also a myth कि मेरा IVF fail हुआ, अरे बाप रे, now I can never conceive. I won't be able to conceive. That's wrong. But one failed IVF, if your tubes are open, if the husband's count is normal, you can conceive naturally. You can conceive with IVF. और अगर अपने खुद के एग से नहीं हुआ, नेक्स्ट टाइम डोनर एग जरूरत पड़ी, लिया, हिस्ट्रोस्कोपी किया, कुछ डिफरेंट किया, तो you will conceive. So one failed IVF does not mean that that's the end of the road. अभी कुछ है ही नहीं, मेरा negative ही result आएगा. It does not affect your body negatively. They say I've put on weight, मेरा वजन बढ़ गया है. No, that stress adds to that weight. You keep on eating food, you rest, you don't do your routine exercise. Any hormone in your body, once you get your menstrual cycle, gets washed out. एक period आने के बाद तो शरीर में से सब hormones निकलते हैं, ऐसे accumulate नहीं होते हैं. After that positive, you continue. After that negative, see that you come back to your normal weight. Weight gain नहीं होता है, शरीर खराब नहीं होता है. लोग साथ आते वो पूछते, अरे बाप रे इतने सारे इंजेक्शन, हमने तो कुछ नहीं लिया था, ऐसे ही कंसीव हो गया. अरे you were lucky, but this girl needs that help. Why do you put a stress on her by telling this? So it does not affect the body negatively. Increases cancer risk. इतने सारे इंजेक्शन के मुझे कैंसर होगा? No. There are so many studies which has proved that IVF injections do not cause breast or ovary cancer. Okay, so there is no increased risk of cancer. There are people who say the IVF हो 3-4 बार करा लो और पहली बार में तो किसी को रिजल्ट नहीं आते. That is also wrong. 35-40% conceive in one cycle only, and younger the age even 50-55%. So if it is done at the right place with the right doctor, embryologist, right lab, you have your chance of conceiving first time, and that's why it is successful. It's not that first time to fail hi jayega, and it's not always 100% successful. Nowadays, patients always come with this, Dr. Frozen is always better than fresh. I've read on the internet. It's not that. Some couples would need fresh transfer, like advanced age hai, low number of eggs hai, embryos बन गए हैं अच्छे, डे 3 पे रख दो, because that is the natural ovary corpus luteum जो support करेगा. So fresh is good for some, जिसको बहुत सारे eggs मिल गया, PCO patient है, उसके लिए frozen is better. Supposing आपका first time fresh नहीं चला तो दूसरी बार frozen करके देखते हैं. But it's not that fresh is not good. Fresh is good for many couples. Just today I had a couple from South India. She had last time wanted to go, 9 IUI failed in South, never conceived. We got 5 embryos. She said, go to blastocyst, do PGTA. Blastocyst पहुंचा ही नहीं. Then we did her ovarian rejuvenation, called her for the second cycle. 3 eggs बने day 3 के, रख दिए, and she is positive today. I said, we don't want to do blastocyst, we don't want to do PGTA. So blastocyst is always better than day 3. That is also wrong. Her blastocyst did not reach, her embryos did not reach blastocyst. 5 दिन के नहीं बने last time. This time day 3 में रख दिया, positive आ गया. So it is the doctor's call that whether a fresh would be better or a frozen, whether a day 3 should be better or a blastocyst. But that is if you approach the clinic. जो clinical सिर्फ एक ही follow करता है, नहीं हमारे तो 1 blastocyst frozen ही transfer करना है, may not be the right clinic for you. You have to discuss what is the best option for you. आपके लिए क्या सही है. एक साइकिल फेल गया तो दूसरा साइकिल कब करना है, ये भी एक कंफ्यूजन रहता है. Do we need a gap? That also your doctor can take a call. If pick up करके fresh किया है, negative आया, तो I would say take 1 month rest, let your ovary come back to normal, you yourself get rejuvenated, even 2 months, then we do your cycle. Egg लिया, number of eggs were okay, blastocyst बन गए, next cycle में frozen करना है, कर लो. There is nothing like immediate frozen gives a bad result or after 2 cycles. But बहुत सारे eggs बन गए, PCO थे, and then you want to take a transfer, I would say wait for 1 month and then we do the frozen transfer. Success rate, we always have discussed what are the success rates. And now Zivia IVF, where I will be available in Jaipur on 24 and 25 for all the infertile couples, 23 and 24, especially male infertile couples will be checked by Dr. Niket. and the laparoscopy patients for fibroids, adenomyosis, burst will be checked and given the treatment. So once over, I thank you all of you for patient listening. Remove those confusions, myths. You can ask your questions and we are ready to answer to clear your doubts about IVF. Shweta, you're muted.
Yes, thank you, ma'am, for the insightful presentation. आपसे मैम 2-4 questions पूछे हैं लोगों ने. Before that, I'd like to also introduce Dr. Richa Nani Aluwalia. She's also with us. She is our lead infertility specialist in Jaipur. And doctor, if you can just put on your video and say hello to all our people. आप सबको, she's based in Jaipur. So Dr. Richa, over to you.
Hello, everybody. Welcome to Zivia IVF.
Yes. So Dr. Richa has been trained personally by Dr. Naina Patel, and she's available at the Jaipur clinic. So all the protocols of Dr. Naina Patel are executed by Dr. Richa Nani Aluwalia, and she's available in the clinic from 9 to 5. So over to you, ma'am, with the presentation, with the questions. A question है कि उनकी wife is 9 weeks pregnant, but the heartbeat is not there. This is a bit.
Okay, so there is a question, yes, that there is a lot of miscarriages. So there could be various reasons for miscarriages, which could be the uterus, the embryo, which could be the immunological aspect. So if I can get to see all the reports, I can find out what it is. Even after 4 miscarriages and highest 8 miscarriages, I have delivered a healthy baby with their own egg and own sperm. There are so many factors that we have to look into it. Once I get all the reports, I can guide you that how well we can go ahead and do the next treatment to see that we can have a positive outcome in the heartbeat and a healthy baby.
Right. And so that is, so Mr. I don't know your real name, but Mr. Appu, we've shared the number. Please come and see ma'am. You're lucky that she's there on 23rd, 24th.
24th, 25th.
24th, 25th, sorry. आप अपना appointment book करा सकते हैं. हमारे slots वैसे बहुत full हो चुके हैं, but we'll see how we can accommodate you. Ma'am, there's another, कोई failed IVF के बारे में बहुत है. In fact, we had a question on, we are also live on Facebook, and we are getting a lot of questions on Facebook as well. One sec, I will just take the Facebook question also. It says, ma'am, मेरी शादी को 9 साल हो गए हैं, मुझे कोई बच्चा नहीं है, मेरे बच्चेदानी small है.
Okay, so I would like to ask her, is she getting her normal menstrual period or not? Small uterus is not a big no for IVF. We can, if her AMH is low, we can do donor egg. If her own eggs are good, we can give her estrogen, progesterone for 2 to 3 months so that the uterus grows a little bit, and then do a single embryo transfer. And then around 3 months, that is the 14 weeks, we can do a cervical stitch. And maybe she'll have to be rested for a long time, but she can definitely conceive.
Very nice. So Mr. Imran, I think if you're, आप अगर ये सुन रहे हैं Facebook पे, आप हमारे number पे phone करके अपना appointment ले सकते हैं, so that we can help you. Ma'am, then there is excellent presentation from Madam from Vishal, Delhi. So yeah, I think more or less we have, I think it's about failed IVF. A lot of people failed IVF है, और हम लोगों को क्या guarantee है कि IVF हो सकता है, हमारा कुछ हो सकता है. तो most of the questions are around that. I see a lot of people, Neetu ji, Pawan, Pooja, Poonam, Praveen, Radhika, Shishir, Shivani, आप सब यहाँ पर हमारे साथ जुड़े हैं. आपका कोई स्पेसिफिक क्वेश्चन है तो आप चैट विंडो में डाल सकते हैं, या फिर आप अपना हैंड भी रेज कर सकते हैं. मैं आपको आई कैन अलाउ यू टू टॉक. मेरी आवाज अगर आप तक पहुंच रही है, आपके पास अगर कोई क्वेश्चन है तो आप पूछ सकते हैं. There is one doctor. Okay. All right. There is question which says
Nil sperm count.
Yes.
Sperm, yeah. Definitely, if the person is from in and around Jaipur, they can visit on 22 or 23. Dr. Niket will personally check, do the hormone test on 22nd. And there is a possibility that sperm count nil ho, to bhi टेस्टिस में बनता हो, बाहर निकलता नहीं हो, जिसको हम ऑब्स्ट्रक्टिव एजोस्पर्मिया, उसमें भी स्पर्म मिल सकते हैं और इक्सी हो सकता है, और नॉन ऑब्स्ट्रक्टिव में भी 20 to 25% चांस रहता है. तो इफ यू आर देयर, यू कैन बुक एन अपॉइंटमेंट फॉर आइदर 22nd, preferably on 22nd or 23rd, to meet Dr. Niket.
Great. I think with that, ma'am, thank you very much for your time. Dr. Richa and Dr. Renu are here. So if there are any more questions, we will manage them. And looking forward to seeing you in Jaipur in the Pink City. Yes. Thank you, ma'am. Thank you. Dr. Richa and Dr. Renu, if you can just be here, ताकि अगर लोगों को और भी कोई questions हैं तो वो पूछ सकते हैं हमसे. या ये जिविया IVF डॉक्टर नैना पटेल का ब्रेन चाइल्ड है, उन्हीं का क्लिनिक है. अगर आपको उनसे मिलना है तो आप हमारे साथ अपॉइंटमेंट बुक कर सकते हैं 24th और 25th को. मेल इनफर्टिलिटी का कोई इशू है तो डॉक्टर निकेत पटेल आ रहे हैं 22nd 23rd को, आप उनके साथ भी अपॉइंटमेंट बुक कर सकते हैं. जिविया IVF केवल 1 महीना ओल्ड है, इसीलिए हमारे कंसल्टेशंस अभी हमने फ्री रखे हैं ताकि ज्यादा से ज्यादा लोग हम डॉक्टर नैना पटेल एंड डॉक्टर निकेत पटेल एंड डॉक्टर रिचा से मिल सकें और अपना सोल्यूशन ले सकें. सो आप प्लीज ये जो नंबर हमने शेयर किया है 9001333909, वहां पर फोन करके अपना अपॉइंटमेंट बुक करा सकते हैं. वी ऑलरेडी हैव ओवरफुल विद अपॉइंटमेंट, सो प्लीज डोंट वेट because this is the last day we are taking any more appointments. मेरी शादी को 10 साल हो गए हैं, एक IVF फेल हो गया है, तो is it possible? Of course possible है पूनम जी. मेरी खुद की फैमिली में 8 लोगों से ज्यादा मैम ने उनको खुशियां दी हैं. और मैम एक्चुअली डॉक्टर नैना पटेल एक खास रीजन की वजह से बहुत फेमस है. जब लोग सब जगह से फेल हो जाते हैं तो उनके पास ही जाते हैं. पहले उनके पास ऑल द वे आनंद गुजरात जाना पड़ता था, अब वो जयपुर में भी हैं और हम सून अब बॉम्बे और भी सिटीज में खोल रहे हैं. तो मिस पूनम, अगर आप राजस्थान में हैं, आप प्लीज आइए, उनसे मिलिए, अपॉइंटमेंट आप भेजिए, अपनी रिपोर्ट्स डॉक्टर रिचा को दिखाइए, एंड इफ इट इज पॉसिबल हम आपको पक्का हेल्प करेंगे. We are here for some more time. अगर आप में से किसी को और भी कोई क्वेश्चन है, हमारी डॉक्टर रिचा अनानी आलूवालिया एंड डॉक्टर रेनू शर्मा इज अवेलेबल हियर टू आंसर द क्वेरीज. सो आप प्लीज बेझिझक होकर क्वेश्चंस पूछ सकते हैं. और अगर आपको ये वेबिनार में समझ में नहीं आ रहा क्वेश्चन कैसे पूछें, तो आप इस फोन नंबर पे भी डायल कर सकते हैं, या फिर अपना हैंड रेज कर सकते हैं, या फिर अपना क्वेश्चन इंग्लिश और हिंदी में टाइप कर सकते हैं. Okay. No more questions to anyone? Okay, now that we are here, let me also share the, I didn't share the pictures of the clinic with all of you. Let me just share that. So this is our clinic in Jaipur. This is our reception. Can you all see it? Pratmesh, can you see it?
Yeah, we can see.
Yeah.
And it's a state of the art clinic. एकदम latest clinic, latest protocols पे बना है. This is our doctor consulting room. Then we have 2 doctors, Dr. Richa Nani Aluwalia, who's the infertility specialist, and we have Dr. Renu Sharma. Then we have a counseling room, we have admin, we have a USG room, which is very, again, state of the art. We have the best machine available. This is our laparoscopic OT. And this is our IVF lab with the latest equipments, andrology lab. This is our IVF OT. And this is our semen collection room, recovery room, OT area, which is fully as per the latest protocols. We also have our in-house pharmacy. And this is our clinic in Jaipur. So for all of you, who stay in Rajasthan, I think it is a boon to the state of Rajasthan that Dr. Naina Patel has started her center there, and you all must take the advantage of it. मैम, मैंने HSG टेस्ट नहीं करवाया तो इस टेस्ट को करवाना जरूरी है क्या IVF के लिए? डॉक्टर रिचा, इफ यू कैन आंसर दैट क्वेश्चन प्लीज.
यस, पहले तो HSG IVF के लिए जरूरी नहीं है. बेसिकली उस टेस्ट से ये पता चलता है कि दोनों साइड की फेलोपियन ट्यूब्स खुली है या बंद. अगर आप IUI करवा रहे हैं, दैट इज मतलब सीमेन को सिर्फ यूट्राइन कैविटी के अंदर छोड़ना, तो ऑब्वियसली HSG बहुत जरूरी हो जाता है. क्योंकि IVF में सीधा हम एम्ब्रियो अंदर डाल रहे हैं, तो हमें ट्यूब्स की जरूरत नहीं रहती. तो फॉर IVF दिस टेस्ट इज नॉट नेसेसरी, बट अगर आप IUI करवा रहे हैं तो इट इज नेसेसरी.
ओके, सो मैम नीतू शर्मा, आई होप मैम डॉक्टर रिचा ने आपका आंसर दिया है. और अगर आप चाहते हैं कि आप मिलें तो आप आ सकते हैं हमारे क्लिनिक में. विधि मेहता का क्वेश्चन है, डॉक्टर रिचा, व्हाट शुड बी द आइडियल AMH फॉर 30-year-old टू कंसीव?
एक्चुअली आइडियल AMH एग्जैक्टली अपन नहीं पॉइंट आउट कर सकते. क्वांटिटेटिवली बहुत बारी लो AMH के साथ भी, जैसे ओवेरियन रिजुविनेशन करके, क्वालिटी ऑफ एग्स शुड बी बेटर. जैसे भले ही 3 या 4 एग्स मिल रहे हैं, पर अगर उसकी क्वालिटी बहुत अच्छी है तो उनके जो एम्ब्रियो बनते हैं उनकी क्वालिटी बहुत अच्छी बनती है, इसीलिए सक्सेस रेट्स अच्छे होते हैं. सो इट इज द क्वालिटी ऑफ एग्स रादर देन द क्वांटिटी ऑफ एग्स.
ओके, सुबिया 82, कैन वी चूज जेंडर इन IVF? इंडिया में आप बिल्कुल नहीं चूज कर सकते. इनफैक्ट ये क्वेश्चन पूछना भी बहुत ही सही नहीं है. सो आई एम सॉरी, वी कैन नॉट डू दैट. स्नेहा बवेजा इज आस्किंग, मेरे 2 IVF फेल हो चुके हैं तो मैं क्या कर सकती हूँ? डॉक्टर रिचा प्लीज.
आप जो IVF फेल हुए उनकी सारी रिपोर्ट्स लेके एक बारी प्लीज कंसल्ट करें, क्योंकि वी नीड टू फाइंड आउट द कॉज कि क्या इंजेक्शंस यूज हुए थे, कितनी एंडोमेट्रियम थिकनेस थी, जो एम्ब्रियो डाले थे वो क्या ग्रेड के डाले थे, वो सब कुछ एक बारी देखना पड़ेगा, उसके बाद हम बता सकते हैं.
तो स्नेहा जी, आप यू आर वेलकम टू आवर क्लिनिक एंड वी विल डू आवर बेस्ट टू हेल्प यू. आई होप दैट आंसर्स योर क्वेश्चन. Hi, good evening. My wife AMH is 0.71 or 71. It must be 0.71. Can we go for IVF with the self egg?
व्हाट इज हर एज, मतलब वाइफ की एज क्या है?
एज आप बता दें प्लीज. एज बताई नहीं है उन्होंने. ये जिसने क्वेश्चन पूछा है प्लीज एज बता दें. स्नेहा, अगेन स्नेहा जी, आप आ जाइए क्लिनिक में. बिकॉज आप ये सब चीजें हमें चैट में बता रहे हैं, तो यू नो इससे मैं डॉक्टर रिचा नहीं आपको पूरा सोल्यूशन दिखा पाएंगे. आप मिस नेहा, आप कहाँ हैं बेस्ड? जयपुर में हैं या फिर कहीं और हैं? दिल्ली. ओके, सो आई सजेस्ट यू डू एन ऑनलाइन कंसल्ट विद डॉक्टर रिचा. आप ऑनलाइन कर लीजिए एक बार कंसल्ट, और आपको अगर लगे कि हम लोग आपको हेल्प कर सकते हैं, देन यू कैन कम टू जयपुर. So please, same number, you can get an online consult. We also have that lady who had said her age is 37.
37.71 AMH लो है, बट एज आई सेड बिफोर, हम ओवेरियन रिजुविनेशन जैसे प्रोसीजर्स ट्राई कर सकते हैं रादर देन डायरेक्टली गोइंग फॉर डोनर IVF.
So अभी ये क्वेश्चन आया है कि वो जो बच्चे की हार्ट बीट नहीं आई है आफ्टर 6 weeks, every time same problem हो रही है. So if you can help this time, so I will come. Can we do anything after they are pregnant?
वी नीड टू, मतलब अभी ऑनगोइंग प्रेगनेंसी में तो इट इज अ बिट लेट, बट ऑब्वियसली फॉर द नेक्स्ट टाइम के लिए उनको पहले से ही आना पड़ेगा. मतलब ऐसे नहीं कि प्रेगनेंसी कंसीव होने के बाद आ रहे हैं.
ग्रेट. मिस्टर पवन कुमार, मैं आपको अलाउ कर रही हूँ टॉक करने के लिए, तो आप अपना क्वेश्चन, मैंने आपको अलाउ कर रहे हैं, आप अनम्यूट करके बोल सकते हैं अभी.
हेलो.
हाँ जी, बोलिए पवन जी.
मैडम, हमने HSG की जांच करवाई थी, उसमें ट्यूब ब्लॉकेज के बारे में बताया था.
एक साइड की ट्यूब ब्लॉक थी भैया या दोनों साइड की?
मतलब बोथ साइड ही है, और एक साइड थोड़ा सा उन्होंने बताया था कि कुछ ओपन सा, रिपोर्ट भी प्रॉपर नहीं देख पा रहे हो, वैसे थोड़ा ओपन है क्या है, ऐसा कुछ कह रहे हो. वन साइड.
भैया दो ऑप्शन है। अगर HSG में ट्यूब ब्लॉक्ड आ रही है तो कंफर्म करने के लिए या तो अपन लैप्रोस्कोपी प्लान कर सकते हैं, जो दूरबीन का ऑपरेशन होता है। उसमें नीचे से डाई डाल के ऊपर से दूरबीन डाल के देखते हैं कि डाई बाहर आ रही है या नहीं, तो उससे एग्जैक्टली पता चलता है। और ट्यूब खोलने की भी ट्राई करते हैं। अगर वो ऑप्शन ना जाके आपकी वाइफ की एज अगर ज्यादा है तो डायरेक्टली फिर IVF का भी ऑप्शन रहता है।
अभी एज 30 है।
आप एक बार ये हॉस्पिटल आ जाओ, फिर अभी तो वैसे ही कंसल्टेशन और स्कैन हो जाएगा, उसके बाद अपन डिसाइड करते हैं आगे कैसे बढ़ना है।
अच्छा अच्छा, ठीक है मैडम।
ओके।
अभी जो मैडम ये टेस्ट भी फ्री है क्या अपने इसमें जयपुर में?
टेस्ट नहीं, कंसल्टेशन एंड स्कैन।
अच्छा, कंसल्ट। ओके ओके मैम, थैंक।
Praveen ji, you are saying, please, ma'am, please connect with ma'am. Which ma'am do you want me to connect with? Dr. Richa is here. If you have any question, you can ask, please. हाँ प्रवीण जी, आप अपना क्वेश्चन पूछ सकते हैं प्लीज। ओके, if found okay, if found small uterus, so shall it approachable to give medicine to grow?
There is no medicine for the uterus to grow, but agar periods are normal, then we can always give hormonal support to conceive.
Right. So मैम ने एक्चुअली ये क्वेश्चन अभी आंसर किया था कि आप उसको you cannot you can't give medicine, but you can actually do some procedures and make it better. So hysteroscopy भी करवा लें। स्नेहा जी, आई सजेस्ट आप एक बार ऑनलाइन कंसल्टेशन कर लें डॉक्टर रिचा के साथ, बिकॉज अभी चैट पे हम लोग पूरा आपका केस नहीं देख पाएंगे। तो आप ये जो नंबर हमने दिया है उस पे फोन करके आप कंसल्टेशन बुक करा दें, एकदम फ्री है। हम आपको पर्सनली गाइड कर लेंगे कि क्या कर सकते हैं हम आपके लिए। थैंक यू। Okay, so now we have, is 2 embryo transfer advisable one?
As in 2 embryos together. अगर day 3 वाले एम्ब्रियोज है, that we can day 3 जो वाले हैं वो हम मैक्सिमम 3 ट्रांसफर कर सकते हैं। जो day 5 वाले जो ब्लास्टोसिस्ट होते हैं वो हम 2 ट्रांसफर कर सकते हैं। वो जो कपल होते हैं वो और एम्ब्रियोलॉजिस्ट बैठ के डिसाइड करते हैं कि उनके ग्रेड के हिसाब से कितने नंबर ऑफ एम्ब्रियोज ट्रांसफर करने चाहिए। इट इज नॉट, देयर इज नॉट एनी फिक्स नंबर के इतने ही करने हैं या इतने ज्यादा करोगे तो ज्यादा सक्सेस रेट आएगा। बहुत बारी सिंगल ब्लास्टोसिस्ट ट्रांसफर में भी बहुत अच्छा सक्सेस रेट आता है। So that depends on the grade of the embryo and the discussion between the embryologist and the couple.
Thank you. Thank you. All right. So I think we've answered most of the questions here today. And once again, I like to thank all the people who've taken the time out to attend this webinar. आपका बहुत धन्यवाद कि आपने ये टाइम लिया और हमारे साथ जुड़े। आप अगर खुद परेशान हैं निसंतानता से और चाइल्डलेस हैं, आप हमसे मिल सकते हैं जयपुर में, और या फिर आपके फैमिली में, फ्रेंड्स में अगर कोई भी किसी को ये प्रॉब्लम हो रही है, आप उनको हमसे मिला सकते हैं। डॉक्टर नैना पटेल का मेन एम है कि वो कपल्स को एक ऐसी खुशी दें जो कि जिससे वो अपनी लाइफ जी सकें। वी आर अ वेरी एथिकल, ट्रांसपेरेंट हॉस्पिटल, एंड हम लोग ट्राई करके आपको बता देंगे कि आपका केस हम लोग कर पाएंगे नहीं कर पाएंगे, जो भी है इट विल बी ऑल ब्लैक एंड वाइट। So please don't wait. I know that the right age for being a mother is when you are in your late 20s or early 30s. आपको डिले नहीं करना चाहिए 35 के बाद, तो बिल्कुल भी नहीं, क्योंकि लाइक मैम ने बताया हमारा ओवेरियन रिजर्व काफी लिमिटेड होता है, और उसके बाद आफ्टर 35 इट्स ऑल वेरी डिफिकल्ट। और IVF इज नॉट अ वेरी डेंजरस प्रोसीजर, बहुत ही सिंपल है, और आजकल इसको इतना इजी कर दिया है जिसमें आपको केवल 2 बार एक प्रोसीजर के लिए जाना पड़ता है, अदरवाइज आपको इंजेक्शंस लेने पड़ते हैं, एंड इट इज वेरी सेफ. और after having a baby from IVF, your IVF babies actually will can have natural babies. In fact, I had a myth that IVF babies are smarter than normal delivery babies, because the pregnant woman gets so much infusion of good hormones and all, but obviously it's not true. So there is no difference between a natural conception and an IVF conception. सो बस वेट मत करिए आप, क्योंकि लाइक मैम ने कहा, डॉक्टर नैना पटेल ने और डॉक्टर रिचा ने, पहली टाइम में सक्सेस मिलना बहुत डिफिकल्ट है. यूजुअली टेक्स 1, 2 or 3 cycles फॉर पीपल टू बी ब्लेस्ड विद अ बेबी. सो आप वेट ना करें. और इन टर्म्स ऑफ मनी ऑल्सो बहुत ही रीजनेबल है हमारा ट्रीटमेंट, और EMI फैसिलिटीज भी अवेलेबल हैं. So you can please come and know more about that from Dr. Renu. And we are here to serve you and to serve people of Rajasthan. So please give us that opportunity. With that, thank you very much. And with that, we'll close today's webinar. Thank you, Dr. Renu. Thank you, Dr. Richa. Thank you, Prathamesh, for making this webinar a big success. Thank you.